Good evening, everyone. We are from Aster CMI. I'm Dr. Kenny Ravish, consultant epileptologist working in Aster Hospitals, Bangalore. So today I'm here on the occasion of International Epilepsy Day, which happens to be the second Monday of February each year. And coincidentally, today is also, as you all know, it's a Valentine's Day with this theme. It's the International League of Epilepsy, which is the organization which plays a role in the educational aspects as well as the social aspects of epilepsy and its management worldwide. It has designed that the theme for this year is to increase the awareness about epilepsy. So it says that show love towards epilepsy patient and at the same time reduce the misconceptions and reduce the myths regarding epilepsy. So with this background, I welcome you all to today's session. I'll be talking about mainly what is seizures, what is epilepsy, what are the treatment measures possible for epilepsy, and what are the myths and misconceptions of epilepsy. And also, before ending, I'll also briefly talk about the first aid measures to be followed when patient has seizures. So, seizure is a neurological condition wherein, in simple words, there happens to be a short circuit happening in the brain. So this leads to abnormal functioning of the brain. So it depends, the symptoms which the patient has depends on from where in the brain short circuit happens. So our brain has a large area, there are two halves, and each half there are four different areas, one of the lobes. So depending from where the seizure starts or short circuit starts, symptoms patient vary accordingly. So it affects the patient, though the symptoms basically can affect the person's thinking, it can affect the person's speech, it can affect the person's movement, it can affect the person's sensations like vision, it can affect the person's sensations like even smell, or it can affect sensations like touch. So the patient's symptoms vary depending on where it starts. And basically, seizures are of two types. We call it the focal seizures and secondly, generalized seizures. So focal seizures, the electric activity remains confined to a small area of the brain. So the patient has symptoms pertaining to that area or pertaining to loss of function of that particular area. And generalized seizures, where the electric activity starts in a wide area of the brain, and the patient commonly loses consciousness and they fall down and have jerking of all the limbs. Along with that, sometimes they have tongue bite and they pass urine without awareness. So, what is epilepsy? So, seizure is a symptom what a patient has, and epilepsy is a neurological disease where patient has two or more episodes of seizures. So, if there are two or more episodes of seizures which occur without any reason, so we mean to say that if there are two or more episodes of unprovoked seizures, then the patient is described to having epilepsy. So basically, to summarize, epilepsy is a disease whereas seizure is a symptom. So epilepsy is a disease where patient has recurrent seizures. So epilepsy is a disease which spares no age group and spares no particular gender in particular. So it can start from childhood and it can last up to the patient becoming old age and ultimately succumbing. So it doesn't spare any particular age group, and also it equally affects males and females. So the cause of epilepsy varies based on the age and based on what is the underlying brain insert. So broadly speaking, the causes can be, we can think of, there are basically two causes. In one, in whom there is some brain issue is happening. So the brain issue which can be there can start right from birth, in the sense that in children they can have seizures during the time of birth or around the time of birth. There can be some deficiency of glucose or deficiency of oxygen which has resulted in seizures. Then other will be brain infections which can cause brain damage and cause seizures. There can be some brain tumors or brain cancers which can cause seizures. There can be sometimes some allergic kind of reactions which we call inflammation, which affects the brain and cause seizures. And sometimes there can be brain strokes, which can be either a blood tube on the brain being blocked or a blood tube may rupture, which can cause seizures or epilepsy. And another important thing in India is road traffic accidents, which are very common. This can cause brain damage and can cause seizures or epilepsy in the long term. So these are the various reasons in which we do investigations and find that the brain some issue is there. But the other group of patients in whom by doing these investigations like a brain scan, do not find any abnormality. In this, the epilepsy is presumed to be genetic. The genetic, mind you, is not hereditary. Only about 10 to 15% have family members having epilepsy, but the rest 80%, there is a sporadic or spontaneous mutation happening in the patient's own gene, which can affect the regulation of the electrical mediators like sodium, and also chloride, etc. So this therein it regulates the way how this electrical current flows in and goes out of the brain, and it can cause seizure epilepsy. So broadly, you can just subclassify into one in whom there is some abnormality of the brain, and the rest of them in their MRI is normal, but they have seizures which are genetic. Now, next coming to symptoms which the patient may have. So symptoms, as I already spoken earlier, it depends on what seizure we are dealing with. Are we dealing with focal seizures? Are we dealing with generalized seizure? So focal seizures, in general, the patient has symptoms known as aura. This aura is a warning sign of an impending major seizure episode. So the aura can be varying depending on where in the brain it starts. So some people have symptoms like vision being blurred, or they see some lights in front of the eye. Some people have sometimes jerking of one particular aspect of the body, which may be the eyes, which may be the face, which may be the hands or legs. Some people have sensations on one side becoming dull or becoming too much, which can precede a seizure. Some people have feeling like experiential aura. They feel like they have gone to some undue world or some new world, which happens before a seizure. Some people can have symptoms like some smell, abnormal smell, stomach ache, then fear, then something like a choking sensation in throat. So these are various symptoms which are the aura, which can happen before seizures. After this, usually the patient tends to lose awareness or lose consciousness, and depending on whether it is just a focal seizure or focal seizure is spread to the whole brain, patient may have jerking of the limbs after this. So these are the symptoms which we come across. So taking into consideration, you can roughly say there are very abundant symptoms are there. So unless these symptoms are kept in mind and are not diagnosed at the right time, treatment will be referred. So that's the reason many times these epilepsy patients, they go to psychiatrist and they are thought to have some mental illness. But epilepsy is not a mental illness, it's a neurological disease for which there are medicines which can be safely taken to control seizures and epilepsy. So next, coming to how do you deal with the patient who is having a seizure. First and foremost, when a seizure happens, the important thing is that we should remain calm. If the patient is having a seizure in a dangerous area like a roadside in the midst of traffic, or if he is in the somewhere he is swimming and has a seizure near in the water, or he has had a seizure from which he can potentially injure, like there are some bushy areas, some sharps which can potentially injure, we should ensure that the patient is transported to a safe zone. So once the patient is transported to a safe zone, we should ensure that we can keep something like objects like a soft pillow under the head to prevent head injury. And usually we should try to turn the patient to one side, which will be preferably right, sometimes even left also. We should to ensure that whatever during the seizure, if there are some secretions which come from the mouth like saliva and all, that is not gone, it doesn't go into the lungs. So by tending to one side, whatever is there tends to come out. This avoids the risk of patient getting aspiration pneumonia, which can be sometimes be a cause of hospitalization and prolonged ICU stay as well. So after that, the next important thing is that people tend to give strange things in the hand. Like they tend to give a key in the hand, some people tend to put a spoon in the mouth, some people tend to put lemon in the mouth, and some people try to hold the patient to prevent jerking. So these all things should be avoided because seizures stop by themselves within 2 minutes, usually in majority of them. But few people tend to have seizures which extend even beyond 2 minutes. So when the seizures happen, it is important that the patient is left alone after the initial phase, so that the jerks stop by themselves. If you try to restrain the jerking by any measures, it will cause more harm than benefit. Patient may injure himself, he may get shoulder dislocation, he may have fracture of the legs, etc. So this restricting the patient should be avoided. So after the seizure stops, the patient for some time may take some time to recover. During that time, it's important that you don't forcefully put anything inside the mouth and do not offer water also to drink unless patient is fully recovered. This is to avoid the risk of, as I told, aspiration choking from happening. And after that, the patient sometimes after the seizure may be confused, he may become sometimes be violent also. So to ensure that he is calm, he is spoken to and reassured, and it is given sufficient time for him to recover. So next, coming to what are the myths and what are the misconceptions of epilepsy and how to treat epilepsy. So the commonest myth is that epilepsy is a psychiatric illness, which I already clarified earlier. Epilepsy is a neurological illness, it's not a psychiatric illness or mental illness. Second thing is that people believe that seizures or epilepsy, there is a short circuitry happening, so the shock may pass from one person to another person. And people, that's why some people refrain from touching a patient with epilepsy. This is a big myth. The seizures do not transmit from one person to another person. Epilepsy patient needs social support. Just because you hold him doesn't mean, or touch him doesn't mean that will transmit to you. So this is one big thing which needs to be clarified. The third thing is that people believe it's an evil deed, and people even engage in sorcery and doing strange things like pujas, etc., and mantras, etc. So these are all misconceptions. It is a neurological disease for which scientific evidence is there to prove that it's a neurological disease. And doing this supernatural things is not going to solve the issue. And the rest I told is regarding treatment aspects, like people do strange things like giving the key in the hand, making him sniff shoe, or making him sniff socks, or putting things in the mouth like lemon, etc. These are all things which have no role in stopping the seizures. So these all should be avoided. So how do we treat epilepsy and how do we manage? There are three important things here. First and foremost is the lifestyle. So important things in the lifestyle to be taken care of is the sleep cycle and avoiding stress. So we should ensure that patient sleeps for a good amount of time, which is roughly about 6 to 8 hours on average. We should ensure that medicines are taken on time and patient also has meals on time. You should avoid too much of straining and undue use of gadgets like mobile phones, television, video games and all should be avoided. As far as possible, patients should avoid taking too much of tension and stress, and you can do other useful measures like doing yoga, meditation, which also help in reducing the seizure threshold, increase seizure threshold. So coming to the next aspect of treatment, it's the medicines. So there are medicines which are widely available in the government setup and private setup and in all the medical stores and online, which can be safely taken without any major side effects for treating epilepsy. We recommend that once we start treatment, the treatment should be taken regularly under doctor supervision for minimum period of 3 to 5 years till the last seizure has occurred. And beyond that, whether the decision to continue beyond 5 years or 3 years, it varies from case to case basis. So if the patient's investigations or like MRI which is there, and one more is the EEG, which is a brain graph which is there, if that is done and shows abnormality, the stopping medicines are risky. So it's not a hard and fast rule that medicines can be stopped beyond 5 years. Majority of them, medicines can be stopped if the seizure is well controlled. It depends on the underlying cause. So by giving medicines, there are about 70% of people in whom seizures can be controlled. In the rest 30% of the people, despite taking medicines regularly, they tend to have seizures now and then. For them, there are few treatment options possible. So when medicines don't work, the treatment options are something which is beyond medical therapy. So herein comes the question of consulting certain specialized centers which have facilities for working up these patients in whom seizures are uncontrolled with medicines. So in them, there is certain investigation required for working up the patient to find out if there is some surgical focus there in the brain which can be removed to control seizures. These investigations include basically an MRI brain which helps to find out if there is some structural problem there in the brain which can be potentially causing seizures. And next is a test known as video EEG, when we admit the patient for seizure recording. So patient is kept in the hospital for a period of about 3 to 5 days, so that sufficient number of seizures are recorded, and during that time we can capture the seizures by the aid of video camera. And because the test known as the EEG is running synchronously with that 24/7, it can pinpoint in the brain from which the seizures are originating, and then with the neurosurgery team discussion, the patient can be taken for surgery for seizure control. So these are the various treatment measures which are possible. So before winding up, I again reiterate that we should show love and affection towards epilepsy patients. They need social support. People with epilepsy are as good as anyone else. They can do the same things which any other person can do. Just because they are having epilepsy doesn't mean they are inferior to other people. But they should ensure that they take precautions like following the lifestyle measures advised, and also taking medicines regularly on time as advised by doctor, and be under regular regular follow-up of the doctor who is treating them. And in certain cases in whom medicines fail to control the seizures, there are options like surgery for epilepsy which can be done safely so that seizures can be controlled to the best. Thank you.
Doctor, we have a question. Should we take a...
So I'll just take a few questions. So I think Kriya has asked what triggers seizures and does it damage brain permanently. So as I told you, the triggers for seizures, again they are told about the causes. The triggers are not actually told. The triggers for seizures basically can be various. The commonest ones are fever, second being low sugar levels, low oxygen levels. Apart from that, taking substance abuse like alcohol, sleeping less, eating irregularly, taking medicine irregular time, and taking too much of tension and stress. So there are various triggers which can cause seizures. And does it damage brain permanently? The answer is that if seizures, with each seizure there is mild amount of neuronal damage happening, but if the seizures are uncontrolled, that is beyond 5 minutes, with each passing minute more and more brain cells die. So if seizures are taken lightly and medicines are not taken regularly and patient doesn't follow lifestyle measures, there's a risk that they can have seizures which last beyond 5 minutes, which we call the emergency known as catastrophic. In this, if the seizures are uncontrolled, there can be brain damage which can be permanent in certain people. Yeah, so another question by Ms. Kriya. So how does ketogenic diet help people with epilepsy? So the dietary therapy is one of the treatment modalities for epilepsy. It is recommended for people in whom medicines fail to control, especially in children who have certain catastrophic epilepsy which affects the development and all. In them, there is an option of ketogenic diet wherein we advise the patient to be kept on a high fat and low carb diet. So this regulates, has been found to have a regulatory effect on the way in which the excitatory and inhibitory molecules which are in the brain are regulated. So this diet is found to reduce the influx, or it prevents the entering the excitatory transmitters from entering the brain called seizures. At the same time, it reduces the outflow of inhibitory transmitters from the brain outside. So therein it has been found to have regulatory effect on seizures. So it is recommended for certain, especially pediatric epilepsies where medicine fail to control seizures.
That's it.
Okay. So I thank all of you for joining, and if any questions, kindly post. We'll be happy to answer offline. Thank you.